Hey, good evening, everyone. How are all you ladies doing? I hope that this Wednesday evening finds you doing very well. So I love this topic, and it's been something that I've uh, even during even during medical residency, we started digging into the importance of vitamin D, and had I had rotations during residency with a doctor that seemed to think outside the box, and this was right up my alley. So um, I really look forward to talking about this topic with you. Before we get into it, though, I do need to say my disclaimer. Let's do that. Um, the information that you will hear during tonight's Wellness Wednesday is health information and should not be considered as health advice. Um, Please do not start taking or stop taking or change the way you're taking any of your medications. And if you think you need to do so, please consult first with your prescribing practitioner to have them help you do that. And lastly, by attending this Wellness Wednesday, it does not establish a doctor-patient relationship. So there you have it. Um, so while we wait for everyone to jump on, that wants to join us, um, let's 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 just jump in. I think that we're good, and I hope that everybody can hear me and see me okay. Um, so we'll jump right in. Okay, so what is vitamin D? Um, I'm going to go through. There's some technical stuff here, so we'll get through it. Hope not to bore you too much. I'll show a picture here in just a moment. Calcitriol. Vitamin D is calcitriol. Okay, also known as 125 dihydroxy vitamin D. It's produced actually in the kidneys. All right, and a few other tissues that express a certain enzyme, 1-alpha hydroxylase. And the kidneys produce calcitriol after a process or series of events that involves the following steps. So I want to share my screen, and we'll look at that. All right, so sunlight. So the body produces vitamin D in a chemical reaction when sunlight hits the skin. There's a kind of a pre-cholesterol precursor that that the sun converts into cholecalciferol. Um, then the liver converts cholecalciferol to something called calcidiol, and then the the kidneys, all right, um, convert this calcidiol into calcitriol through the action of an enzyme. Okay, now that enzyme um, is is really important, and when you have healthy kidneys, this is not a problem. As you can see, also we can get as that uh, first step, goes into the bloodstream as D3. Okay, you're most of you are familiar with with D3 because that is what most supplements contain. Now there's another way to get vitamin D, and that is through your diet, and I'll get into that in a minute. Um, there's also a prescription form of D2, which you can get. It's generally in 50,000 units, that typically doctors have you take once a week. So that's another way to get vitamin D into your blood circulation here. And then it can be converted through those pathways that I just described, just simply through the liver and through the kidney. And then vitamin D, active vitamin D, uh, hits the target tissues. Okay, so thought that would be fun to show you a little bit of a picture describing that. Okay, parathyroid hormone, PTH, which regulates the levels of calcium, phosphorus, and magnesium in the blood and bones, by the way, and it is a major inducer of the enzyme, which tightly regulates this conversion and serves as the main control point in calcitriol production. So that active vitamin D is now called calcitriol, and that's what works in your tissues. So it's the biological hormone, okay, with many activities. So vitamin D, basically you can think about it like this. It may start out like a vitamin, but then it becomes a hormone through various enzyme activities. Okay. Now, these activities that vitamin D helps with or has in your tissues include preventing osteoporosis, includes proper immune system regulation, include preventing cancer. The way it does this is, look, when your cells reach their maximum point of maturity, and it's actually time for them to die, because I mean, you don't want your cells to die prematurely, and you want new cells coming in to be able to become the cells they need to become. This is an interesting kind of tidbit where we do have cellular turnover in our organs at various rates. For example, in the gut, the cells turn over every few weeks, whereas in our organs, such as organs and glands like the thyroid, like the heart, they turn over every 7 years. So when a cell is supposed to, when it reaches its point of maturity and it's supposed to die, if it doesn't get the right signal from vitamin D, it can become cancerous. Okay, it can keep going in a bad sort of way. Okay, and I'm not going to get into the specifics of that. It's a little more complicated. Okay, vitamin D prevents inflammatory skin changes, like you would see with psoriasis, and therefore other autoimmune issues. Vitamin D is an antioxidant. This this hormone regulates moods. All right, it modulates moods. It regulates thyroid hormone binding. So when your thyroid hormone goes to, it gets into the cell and it goes to its receptor on the DNA inside the nucleus of the cell, it needs vitamin D there, as well as a couple other things, to be able to bind and do its job. So I always say, much like, I always say thyroid hormone is like the key that starts the motor. So much like you have to, do certain things in order to start your car in the first place. Yeah, you have to have the key and you have to turn it in the ignition. However, if the car's not in park, if your foot's not on the brake, if there's not enough gas, if there's, if the battery's dead, that car's not starting. So you have to have vitamin D to help thyroid start the motors. All right. And vitamin D also regulates glucose metabolism. So in these two ways, vitamin D regulates metabolism, right? It's so important. And it's important for cell growth. All right. All right. Vitamin D is also important for the metabolism of minerals. It's involved in the transport of calcium through the intestinal lining, okay, into the circulation of the bloodstream. Vitamin D aids in neuromuscular function. So how your muscles help how your nerves help your muscles function. You got to have vitamin D there. Vitamin D promotes skin health. And therefore prevents hair loss. Interesting. Uh, and then it also increases serotonin production. Well, that's important to, um, well, keep us happy, right? It's one of those happy hormones that we need. All right. So, um, this. All right. So its main sites of action are in the intestine, bone, kidney, and then with parathyroid hormone. Okay. Um, few foods naturally contain vitamin D. All right. And I'll just mention these. The flesh of fatty fish, such as trout, salmon, tuna, mackerel, and fish liver oils are among the best sources. Beef liver, egg yolks, and cheese have small amounts of vitamin D, and then mushrooms. Okay. Other than that, you really don't find a whole lot of vitamin D in in foods. And of course, you gals know that cheese isn't among you know the foods that we should have, so that's not a great source for us. All right, let's talk about a few diseases that relate to vitamin D. Now, vitamin D deficiency in children leads to rickets, or the bowing of the lower legs or the long bones. Deficiency in adults leads to the disease of osteomalacia. So it's basically just the softening of the bones. Vitamin D deficiency or insufficiency occurs in several other situations. So you could have genetic defects in the receptor for vitamin D. There's a number of different mutations that have been identified in humans that lead to hereditary vitamin D resistance. And that's, again, a problem with the vitamin D receptor. If it's not the right configuration, that receptor, it's not, if it's the wrong configuration, it's not going to work. If it's the right one, it will. Severe liver or kidney disease can interfere with the generation of the biologically active form of vitamin D. Okay. Um, and then the most common thing is insufficient exposure to sunlight. So elderly people that stay inside and have poor diets often have at least subclinical deficiency. And I have found that it's more than that usually. It's not just subclinical. Ironically, it appears that hypovitaminosis D, or low vitamin D, is very common in some of the most sunny countries in the world. And this is, of course, a problem with, the cultural dictates that, women be heavily veiled when outside in public. And so they just don't get the sunlight exposure to vitamin D. All right, let's talk about sunscreen. So sunscreen, especially those with SPF ratings greater than 8, it doesn't have to be much, effectively blocks synthesis of vitamin D in the skin. However, people that use sunscreens religiously generally live in industrial countries where many foods are supplemented with vitamin D, and vitamin D deficiency is somewhat averted by dietary intake. I will talk a little bit more about this too. Vitamin D toxicity is usually the result of overdosing on vitamin D supplements. I'll tell you that this is very difficult. Certainly vitamin D supplements are a valuable treatment for patients, individuals with deficiencies. But you can have over ingestion over, a period of weeks to months, which can lead to toxicity in humans, especially due to hypercalcemia, because the more vitamin D you take, the more calcium is released from the bones in an effort to recycle and continue with that cycle. But yeah, we know better how to help with that. Now, excessive exposure to sunlight rarely leads to overproduction of vitamin D. Okay. Um, and again, I'm going to say a little bit more about this later. I want to read a recent change to guidelines by the Endocrine Society. So Endocrine Society releases new guidelines advising physicians to not screen for vitamin D, which could affect test referrals to clinical laboratories. All right, I'm going to read part of this. Clinical laboratories may eventually receive fewer doctor's orders for vitamin D testing thanks to new guidelines released by the Endocrine Society. The new clinical practice guidelines advises against unnecessary testing for vitamin D levels. It and by the way, new guidelines also advise people to limit their vitamin D supplementation to recommended daily doses. Okay, that's part of this too. It also urges healthy people and those 75 years of age or younger to avoid taking the vitamin at levels above the daily recommended amounts, according to a news release. The society shared its recommendation. Skipping. Even though the Endocrine Society does recommend vitamin D supplements for certain groups, it advises individuals to hold off on routine testing. That's because, get this, there appears to be uncertainty among ordering clinicians about what to do for patients based on their vitamin D test results. Okay, ladies, this is like when a doctor said to my patient, if I can't interpret the test, you don't need it. When clinicians, and I'm reading on, when clinicians measure vitamin D, they're forced to decide what to do about it. Well, yeah, and they should know what to do about it. That's where questions about the levels come in, and that's a big problem. So what this panel is saying is don't screen. All right, gives the name of the director of clinical and anyway. We have no data that there's anything about screening that allows us to improve quality of life. Screening is probably not worthwhile in any age group, he added. Now, this is fascinating. Real quick, one exception to the guideline applies to people with already established osteoporosis. According to the guidelines author, and I'm not going to read the author's name, the author endocrinologist. This is what's fascinating, ladies. So during a panel discussion at the Endocrine Society's annual meeting, members acknowledged that many studies have shown relationships between serum concentrations of 25-hydroxy vitamin D and physical disorders, including those of musculoskeletal, metabolic, and cardiovascular systems. Still, they question the link of vitamin D supplementation and testing with disease prevention. They said, quote, there is a paucity of data regarding definition of optimal levels and optimal intake of vitamin D for preventing the specific diseases. What we really need are large-scale clinical trials and biomarkers so we can predict disease outcome before it happens, said so-and-so, this endocrinologist director. Well, you bet we need studies. We do need to study this stuff, but why won't they? Because this doesn't make anybody any money. It costs money to study this. They're not going to make any money on a simple vitamin D. Okay? So, of course, they're not going to, yes, they acknowledge that studies are needed. Of course they are, but they're not going to do them because it would cost them too much. Okay, I'm going to read a couple more things. The use of 25-hydroxy-D testing in clinical practice has also been increasing. However, the cost effectiveness of widespread testing has been questioned, especially given the uncertainty surrounding the optimal level of 25-hydroxy-D required to prevent disease, the authors wrote. Well, who does this cost effectiveness affect? Yeah, you're right. It affects insurance companies. Okay. The insurance companies who are asked to pay for the testing. So this is why they don't want you to test. They don't want to screen for it because they don't want to have to pay for you to get healthy. This just boils my blood, ladies. This is so, it is unacceptable. It is, just simply not acceptable. Thus, the panel suggests against routine 25-hydroxy-D testing in all populations considered, the researchers stated at the Endocrine Society annual meeting. Furthermore, they go on to say, quote, screening for vitamin D deficiency leads to hundreds of millions of dollars of waste in testing costs annually. Again, who does that apply to? Insurance companies. Okay. The AAFP noted in an editorial on the organization's website. So they don't recommend it now. Now, I'll say this. The Vitamin D Society, someone who actually cares about your health, said this. Updated vitamin D guidelines, and I'm reading off my screen, are just released by the Endocrine Society, suggest that most adults should take no more action than a recommended, take no more than the recommended daily allowance as set out by the outdated 2011 Institute of Medicine document. However, this recommendation has led to high rates of deficiency and associated diseases, harming the population worldwide. In addition, the new guidelines do not advise testing 25-hydroxy-D levels among any population, even for the vulnerable, nor do they define a sufficiency level. This recommendation is short-sighted, dangerous, and confusing, and is a significant step backward from what the Endocrine Society previously recommended for vitamin D in 2011. This is a prime example, ladies, of how someone other than your doctor is deciding how to care for you. This is a prime example of how insurance companies and perhaps government agencies are inserting their agendas into caring for your health, and it's not caring for your health, and it is it's atrocious. This is what I have found in practice is that most women, especially with autoimmune disease, autoimmune thyroid disease, and whatever autoimmune disease, have low levels of vitamin D. Most of us living in the US lack it, period. All right. Most of us need supplementation. Now, it should be noted that vitamin D should be taken with balanced amounts of vitamin K2 so that not too much calcium is mobilized out of the bones that isn't able to get back in. Okay. This can prevent the overdosing, making any risk of taking enough vitamin D much lower. Okay. All right. Now, a little more on the lighthearted side. Now that I've got that off my chest, an interesting side note. So sunbathing has multiple health benefits, right? Including vitamin D production, as we have learned, and boosting our immune system. However, given the increase in skin cancer cases over the last few decades, experts recommend limiting our exposure to 5 to 20 minutes a day, depending on the season's year, right? The first thing to consider is that the sun rules our circadian cycle, right? That is the internal clock that regulates the cycles of sleep and wakefulness. Therefore, according to the experts, exposing ourselves to its, the sun's rays improves our willingness to sleep at night. In addition to improving our quality of sleep, sunbathing has other benefits such as achieving optimal levels of vitamin D, strengthening our defenses, and raising our serotonin levels, right? Now, according to one expert, it should be mentioned that 80% of the vitamin D that our body receives comes from the sun, and we can only get 20% of it through food. Okay, so if we don't get enough sun, then we have to supplement. Bottom line, we have to supplement. The same expert recommends sunbathing for 5 to 10 minutes a day during the summer while it's during the day, during the summer. If it's winter, it could be up to 20 minutes, okay? Now, it isn't necessary to expose the entire body, okay? 40% of your body is enough. So, arms, your head and neck, legs, however they do say, and of course, they're going to, the article that I was reading about this was careful to say that, yeah, you still need to protect your skin, wear hats and, sunglasses, I don't know, like wide brim hats and, to limit facial exposure. I'll tell you this. Cancer of any kind, including sun cancer, starts on the inside. If you're imbalanced on the inside, you're much more likely to have problems with UVB exposure, from being out in the sun. Okay. An abstract for a PubMed study in a dermatology journal entitled "Sunlight: A Time for a Rethink?" says this: UVR is a skin carcinogen, yet no studies link sun exposure to increased all-cause mortality. Epidemiologic studies from the United Kingdom and Sweden link sun exposure with reduced all-cause cardiovascular and cancer mortality. Vitamin D synthesis is dependent on UVB exposure. Okay. Individuals with higher serum levels of vitamin D are healthier in many ways, yet multiple trials of oral vitamin D supplementation show little benefit. Of course, they have to say this because the studies are not plentiful. There are no large-scale, vitamin D studies because who's going to pay for it? Growing evidence goes on to say that growing evidence shows that sunlight has health benefits through vitamin D independent pathways, so not through vitamin D conversion, such as photomobilization of nitric oxide from cutaneous or skin stores with reduction in cardiovascular morbidity. Reduction in cardiovascular morbidity. Okay, so heart attacks that aren't necessarily fatal. Sunlight has important systemic health benefit as well as risks, and again, they have to put that in there, right? Okay. I think we are clear that vitamin D is super important. Okay, we need it in so many aspects. I could run through that list one more time. It's needed to help prevent cancer. It's needed to turn on our metabolism. It's needed to help us produce more serotonin. It's needed to help us metabolize our minerals. It's needed to transport calcium into our bloodstream through the gut. I mean, so many things. This it's important for our bone health. So many things that vitamin D, this very important hormone, does for us. And it's, we check and monitor vitamin D in levels in all of our patients because this is so important. It's vital to their success in achieving their health goals. So it's important that we understand why we need vitamin D, and we've discussed its role in our physiology, including the way it impacts our thyroid health too. So let's get outside a little bit, and if we can't get enough, enough sun as we get outside and get some sun, we definitely need to test for it, despite what the Endocrinology Society recommends. and monitor it so that we know what levels we should be at. All right. It's very individualized. Um, Vitamin D is stored in our fat as well. So the heavier we are, the more vitamin D is stored in the adipose tissue, and it is more difficult to get those levels up. But and the color of our skin does matter some. The darker our skin, the more difficult it is to get enough vitamin D conversion in the skin. So um, it's very individualized what levels we need, right? It needs to be tested for in the right way, and it needs to be monitored. All right. It is very difficult to be toxic. I'll tell you that. Some of the other signs of toxicity or symptoms of toxicity would include um, increased pain, stomach pain, like intestinal pain, um, achiness, like joint achiness, in absence of any other reason for it, diarrhea, um, again, in absence of any other reason for, that type of a symptom. So it could cause headaches, and um, it certainly can, if you're super, super toxic, um, put you into a coma. But ladies, I have never seen a case like that ever in my life, in my practice. I when I was studying this back in medical residency, um, this was it's so rare. That just doesn't happen. It's so difficult to get so toxic with vitamin D that would happen. So it's very, it's safe. We don't have to freak out. Doctors don't have to freak out about high vitamin D levels. All right. So, all right. Uh, I'm going to check my text for questions, and we can answer some questions. Um, all right. So the first one is, how much vitamin D is needed? What else? What should the blood levels be? Again, hard to say how much is needed as a blanket statement, but I do like blood levels to be between 50 and 90, and ideally right there in the middle is great, around 70 for 25 hydroxy D. Um, there are tests for 125 hydroxy, so that's the active dihydroxy, vitamin D3, where we can look at the active levels, um, and those are going to be honestly pretty similar, at least 30 in that with that test. And yes, is D3 best taken with vitamin K? So I answered that. It should be taken with vitamin K, not potassium K, vitamin K2. Okay, K number 2. I've been told that the best time to be in the sun is okay. Let me see if I can. It's. I've been told that the best time to be in the sun is on a day when there is a broader spectrum of light to soak it up. Is this the case? Yeah, I mean, ideally when the sun is directly overhead. Uh, if you can, get out there, expose 40% of your body, your skin um, to the sun for a good, 5 to 10 minutes in the summertime. Then you can use some sunscreen. But if you automatically go out with sunscreen on, you're going to have a hard time converting vitamin D at all in your skin. Um, Next question, does every part of your body have to be exposed? No, no. So like I said, about 40% of your body should be exposed. Um, out of curiosity, do they teach nutrition like the need for vitamin D in medical school? Um, very little, honestly, very little. Um, that's why I've had to do a lot of additional, you know, education in nutrition, and yeah, because they just don't teach that too much in medical school. What about sunscreen? Should it be avoided? Like I said, too much exposure certainly can be risky. So I would say go out for the first few minutes. Don't put anything on as far as sunscreen. After a few minutes, uh, then put the sunscreen on and um, and go have some fun. Does the brand of vitamin D matter? Okay, that's a good question. Yes, I'm not going to necessarily get into the brands, but um, vitamin D is made from animal oils or some plant oils. And so, yeah, and if it's made from like soy oil, it definitely should be non-GMO and organic soy oil based. Um, some people have, uh, some sensitivities to some of the plant-based oils. It's much better if it does come from fish. Um, so maybe that would be the best thing to look for when you're looking for the right brands. And then the question is, are there sunscreens on the market that have harmful ingredients? Well, yeah, most of them do have harmful ingredients. Uh, it's helpful to look for those that do have more natural ingredients. There's so many brands out there, ladies. I can't remember off the top of my head the brands that we've used in the past. But yes, there are some, most generally available cheap brands of, and I'll say cheap brands are, they contain harmful ingredients that I would recommend against using. Um, so just look for more of the all natural type things. I know that's not always, it still can be kind of a misnomer, all natural, but um, yeah, you can find some good natural sunscreens out there. Okay, so if there are no more questions, I will wrap up this topic for tonight. Thank you so much for joining me. I hope you have found this helpful. It's such an important topic. I'm confident that it has helped a few of you. So, like I said, let's get outside a little bit and get some sun, and be cognizant about the very important need we have for vitamin D. All right, ladies, have a great evening, and we'll see you soon. Take care.